It is understudied compared to other non-communicable cable disease, yet almost 10 million new cases emerge every year. Dementia is the focus of our conversation today. Welcome everyone, wherever you are. My name is Rawa Oje, and I will be your host for this panel part of WISH 2020. I lost my life when my mom lost her cognitive abilities. I am now her shadow. I am not complaining from my duty towards her, but I am complaining about the lack of support I have. My husband left me as he couldn't see how we can have a normal life with her living with us, and I had to sacrifice my career and settle for a job that gives me more time to care for her. This is the testimony of a young woman caring for her mother suffering from Alzheimer. Dementia is a disability that drastically affects the life of carers as well. To talk more about policies that need to be taken to support both patients and carers, I will introduce members in alphabetic order. I have with me in the studio Dr. Omar Al-Ajnaf, Executive Director of Qatar Biomedical Research Institute. We also have with us from Doha Firas Al-Mir, Research and Policy Development Officer at WISH. We have also Paola Barberino, Chief Executive Officer at the Alzheimer's Disease International ADI, and Dr. Suzanne Hamad, Independent Research Consultant and former advisor to the Center for Elderly Empowerment and Care. Feel free throughout the panel to send us your question and to whom you would like to address it. We will try to make this conversation as interactive as possible. Each member will have 3 minutes to answer my first round of questions. Then we will move to your Q&As, so make sure you send us your question as soon as it comes to your mind. We would also like to hear from you. Tell us where you are watching from and with a photo on social media using the hashtag #VirtualWish2020. So let's start with the WISH report this year about dementia. Mr. Almir, can you begin the session by giving us a brief overview of the report? Firas, I think you need to unmute your teams. Perfect.
Can you hear me? All right.
Yes,
as we established, hi, my name is Faraz Almir. I'm a Policy Research Development Officer at WISH and one of the co-authors of the Dementia Policy Paper. Before I get started, I would like to thank my co-authors, two of whom are on the panel with us, Ms. Paola Barberino and Dr. Suzanne Hamad, as well as Dr. Hanadi Al-Hamed, team leader at Qatar's GDO team, Chris Lynch, Deputy CEO at ADI, and Dr. Ayaz Menek of Weill Cornell University. I'm assuming that many people tuning in will at least be somewhat familiar with dementia. But just so we establish a baseline, dementia refers to a number of chronic diseases that affect the cognitive functions of an individual in multiple ways, impairing things such as memory, orientation, the ability to focus, mood regulation, as well as a host of other possible symptoms. Its occurrence in individuals correlates strongly with age, but it is not itself a natural part of aging. Dementias are multifaceted conditions. When not given timely and effective intervention, they significantly alter the quality of life, not only for the person with the condition, but also for their carers as well. As we've heard from the testimony earlier, it also puts a cumulative strain on healthcare systems globally. According to the WHO, the projected economic cost of these strains will reach $1 trillion by 2030. Similar findings from the WHO say that as many as 40 million health and social care jobs and an additional 18 million health workers are needed to bridge the divide between the need for care and care provision. This is a global disease that requires coordinated national strategies, but we as a global community are falling behind on these global commitments. Early in the year, ADI published their third Plant Impact Report, revealing that only 33 countries at the time of publication had created national strategies, although this number has been bumped up since the writing of this policy paper and up to our session now, with a few more countries such as China and New Zealand coming out with national plans. Still, the overall trend is there. This is why our policy paper is significant. Qatar has made sincere nationwide efforts to tackling dementia, and the policy paper was authored to bring its commitments, successes, and future opportunities to light and present them to a more international audience. The paper, pardon me, the paper outlines a broad strokes history behind the policy infrastructure that was laid out prior to Qatar's National Development Plan of 2018. While Qatar does not currently have published prevalence statistics on dementia, we can glean, based on estimates provided by the WHO, that there will be a projected 40,000 persons with dementia by 2050 in the country. In light of the potential challenges, Qatar has made national commitments to tackling dementia at least as far back as 2015 by joining the Global Dementia Observatory, a WHO-based cooperative global network dedicated to sharing best practices and data on dementia care, and being the first country in the EMER region to do so. In that same year, the National Dementia Stakeholders Group was created, comprised of the major healthcare providers such as PHCC, Private Healthcare Corporation, Biomedical Corporation, as well as care, advocacy, and research groups, as well as the Ministry of Public Health and other ministries, such as the Ministry of Justice, acknowledging how cross-cutting the challenges of dementia are. The paper then discusses the policy commitments and successes made by utilizing that infrastructure in the wake of the QNDP, with a few current ones that I'd like to outline now. The establishment of the Raha National Alzheimer's and Memory Services Helpline, established in June, so quite current in light of COVID as well as the Memory which is a confidential service offering support and guidance to people with dementia and memory loss, and also providing support for their carers. The creation of the National Dementia Education and Workforce Training Program for nurses and carers in collaboration with ADI is the second one. Third was the creation of the National Clinical Dementia Guidelines. Fourth, creation of the Memory Outreach Program. There's also been the creation of memory clinics and PHCC, the establishment of multidisciplinary memory clinics for neurology, neuropsychology, geriatricians, old age psychiatry, occupational therapy for more complex cases. And also the development of the Qatari version of the Adam Brooks cognitive examination. Moving on from the policy commitments and successes, the paper also discusses the progress made in both clinical and social research in Qatar. On the clinical side, clinical corneal confocal microscopy, an ophthalmic technique originally developed for assessing diabetic neuropathy, has been adapted to monitor for dementia as well as a number of other neurodegenerative diseases. And it has proven reliable enough to have received positive responses from the Alzheimer's Drug Discovery Foundation for more dedicated testing on dementia in Qatar. On the social research side, a few landmark publications have been made. In 2020, the first book comprehensively assessing the mental health landscape in Qatar was published, a collaborative effort between experts from multiple sectors, framing dementia through the lens of mental health for elderly adults and analyzing access to care and the policy landscape through that lens. In 2019, collaborative research between the University of Qatar and Ihsan outlined the challenges faced by home-based carers in a bid to address two major gaps in the knowledge base on dementia: information about the care and experience in regards to access to care, as well as the socio-cultural considerations specific to Qatar. There has also been collaborative research between Doha International Family Institute and the University of Calgary, outlining socio-demographic and economic considerations for family caregiving. The paper then discusses opportunities to further exploit and build off the groundwork established in Qatar. Further streamlining service provision by leveraging the network and resources provided by the National Stakeholders Group. Fostering community engagement by expanding on the representation and consultation of family caregivers and activating their roles within the larger scope of dementia care. 3, bolstering intersectoral collaboration. 4, utilizing religious and cultural norms to improve messaging, reduce stigma, and encourage health-seeking behaviors. And 5, advocating for continual pushes for awareness that are expanded to more consistent initiatives that aren't just tied to World Alzheimer's Month or World Alzheimer's Day. The paper ends on lessons that can be learned from Qatar's example expressed as policy recommendations. Firstly, by improving health and social care for persons with dementia and their carers. Second, facilitating help seeking before dementia is at the advanced stages by combating stigma and misinformation. 3, creating dementia-friendly spaces and social support for older persons. 4, mitigating the burden on families by providing more advice and support throughout the caregiving journey. 5, establishing a baseline of epidemiological and social data to support evidence planning and prevalence of dementia. 6, developing more specialized human resources in geriatric psychiatry and gerontology, health and social care professionals. And that was the final one, pardon. Hopefully, with the contributions of this paper, the efforts of Qatar can be realized by the global community. And in doing so, help realize the dream of a more dementia-friendly global community. And yeah, that's it. I'm done.
Could be setting an example, since you might be able to have the infrastructure to do it. Dr. Al-Ajnaf, the Qatar Biomedical Research Institute is one of the leading regional research centers on dementia. What are the most promising developments in the field?
First of all, thank you very much for inviting me to take part of this session. I think let me introduce you to Qatar Biomedical Research Institute, QBRI, which is a national institute operating and part of Hamad bin Khalifa University, aims to improve healthcare by innovation, through innovation in prevention, diagnosis, and treatment, and targeting diseases affecting Qatari population as well as the region. So Qatar Biomedical Research Institute established research centers under its umbrella, where they identified one of the most challenging diseases, including diabetes, neurological disorders, cancer, infectious diseases, and so on. Lately, we developed the Neurological Disorder Research Center, which is the only one exists in the region. Excuse me. So this unique new research center, which exists only in the only one exists in the MENA region, is focusing on brain-related diseases that affecting, for example, children, like neurodevelopmental disorders, as well as tackling neurodegenerative diseases, including dementia, as Alzheimer disease, dementia with Lewy bodies, and so on. What we have noticed, I mean, studies have been reported very clearly that there's a strong association between diabetes and dementia, and other complications. So you find diabetes type 2 patient, they about 40 to 50% of those more likely would develop some sort of dementia, including vascular dementia, Alzheimer's disease, and so on. So that's really very, very serious, in a way that, as you know, in the population in Qatar and as well as the region, about 70 to 20% of our population affected by diabetes type 2. So as our population aged, and 10, 15 years from now, I think dementia will be more and more challenging for us. So that's why QBRI took an initiative and established an interdisciplinary program that focus on diabetes with dementia. Mm-hmm. And in collaboration with the Cornell Medical College at Qatar, as well as as well as HMC, mm-hmm. we put together interdisciplinary program where we identify, cohort of patient with diabetes with early dementia, MCI, as well as diabetes with dementia, diabetes without dementia, and healthy controls, to follow them for 4 years. So this approach, which we would like to apply holistic, omics, which advanced technology to identify blood markers for dementia with diabetes with dementia. The aim is to identify markers or risk markers that will help us to identify individuals or diabetes patients, those have high risk of developing dementia. Mm-hmm. And we are very, very excited this approach will lead to successful outcome. As you know, the early we interfere with any disease, the better outcome. So our aim is to identify risk markers that will help us to tackle the dementia as early as possible, including Alzheimer's disease. Mm-hmm. However, there's no simple blood test or a non-invasive test nowadays available, and therefore we aiming and we really putting so much efforts with our expertise and experts on the to tackle this issue and try to come up with the specific markers that associated with our population, our population, and hopefully that will lead to better treatment, specifically personalized medicine.
Thank you, Dr. Al-Ajnaf. Dr. Hamad, you led the first qualitative study on dementia caregiving in Qatar in 2016 and 2017. What key gaps did the study identify, especially as far as the community-based and social aspects of sustainable dementia care are concerned? And what still needs to be done in order to close these gaps and strengthen efforts currently being taken? Dr. Hamad, you need to unmute your...
Rawa, thank you very much for your question. And I'd really like to thank Firas and Dr. Omar for a brilliant overview of all Qatar has been doing. It's really taking huge strides and something to be proud of. I'd like to also take this opportunity to thank WISH for always considering the social and behavioral aspects of health issues, and particularly when it comes to dementia. Dementia is a disease that begins at home and ends at home. So the greatest onus is really on the family and the community. And this qualitative study that we conducted for the first time took us into the private realm of the family. And we are really grateful to these families because it's a very sensitive issue. And it showed us things from their perspective, from first signs through to diagnosis and management and care. And this is the stuff that the healthcare system does not see until someone presents himself or herself to their older person to the system. So one of the most striking gaps you asked me that I'd like to flag today is that most families still don't fully understand what dementia is and what it entails in all its stages. So they're rarely prepared for what hits them when a loved one in their family gets it. And we found a lot of misinformation, a lot of denial, a lot of stigma associated with it, lack of awareness of what are the pathways of care, what are the benefits available. And also there were a number of prevalent beliefs rooted in the local culture that acted as a double-edged sword. So on the one hand, a deep respect to protect and show dignity to the older person often led to delayed or prevented help seeking. So this is very important because this means that the cases of dementia reach the healthcare pathways in middle or advanced stages, and we want an earlier detection. It also means that families get much less support than they need at a later stage. So they're carrying a heavy burden for longer. And it also means that now we have some very rich data that helps us make our interventions much more effective and our campaigns more effective, because we can speak to the minds and hearts of people using their own beliefs and systems. Now, what needs to be done? That was the second part of your question. Qatar has a very good infrastructure in place. It's got a national plan. It's got strong leadership. It's got the human and financial resources. What we need to invest more now is bottom up to support all this infrastructure. And this needs to be done with and for families. I want to focus on 3 areas that I think is the way forward at the moment. So number one, communities need to be empowered with knowledge throughout all the stages, pre-diagnosis, at diagnosis, as things progress. And this can entail multilingual educational materials, health promotion outreach programs, much more coordination between health and social sectors to maximize the reach, and mobilize schools, universities, mosques, community centers, local ambassadors of caregivers who've been through it before, social media influencers, everyone. Let's step it up a notch, just like diabetes and cancer and mental health campaigns in Qatar have done and really achieved huge change. Focus on prevention within these education campaigns is so essential. And I'm sure many of you have heard about the Lancet study that really spelled it out in as simple as possible. Just like other NCDs, lifestyle changes can and will improve brain health and prevent or delay cognitive impairments by, listen to this, 40%. I mean, 40%, that's almost half. You can prevent things reaching a level where it's very difficult to cure. And as we all know, this is an issue, like once it's advanced, it's very hard to slow. But the thing is, efforts need to be systematic and coordinated for maximum impact. The second thing we need to do is support families more systematically and effectively. Many are still falling through the cracks, and through my previous job, I found that a lot of people during the COVID pandemic were regressing. So the families had a heavier burden, and the achievements we had made in their cognitive and physical progress went back. There was a lot of anxiety, a lot of withdrawal. The isolation did not help. So community outreach programs are more important than ever. They have to continue throughout the care journey, and families need continuous education, information, because this disease does not stay as is. It grows, it progresses. It's you know, and I say this as a carer myself. My father passed away many years ago with this disease, so I know it firsthand, and they need support throughout the stages. They need opportunities to vent and so forth. But families don't only need help. Families, we need to see them as partners and resources in holistic care, because it's a long-term disease, and they can support us in earlier detection, and they can support us in end-of-life care. In the long-term care. So they can be community educators, ambassadors, and the Qatar Association of Caregivers that has been spearheaded by the Hamad Geriatrics team is really a huge achievement and a great platform to mobilize families and reach out to them more. We should not forget those frontliners that are in direct contact with families. They also need more capacity building and more sensitization, because even them, you know, they admitted in our study, they said, you know, I mean, we also need to know what to do and how to pick up signs and how to be trained on basic early intervention. Finally, you can never have too much research. I think there's a lot to be done and an appetite and a need for it. So research ensures that interventions and services and campaigns are spot on. They're tailored for Qatar or for whichever context we're talking about. We also need to evaluate what we've done. What have we achieved? Is it effective? Should we change it? Should we fine-tune it? Should we expand it? Should we scale up to other countries? What can we exchange with other countries? I have a whole menu of possible research that needs to be done. We need to do knowledge, attitude, practice studies. What do people know? What do different generations know about dementia? Children, youth, older people, middle-aged. We need to look at gender aspects. We need to engage persons with dementia in their earlier stages in the research. Let's hear from them. What does this feel like? I remember my father telling me, Suzanne, what is happening to me? So there is a stage where they know something is happening. Let's talk to them. Let's hear from them. Let's support them in that early stage. A closer look at the risk factors in the Arab context. There's just a lot, and how to protect persons with dementia during pandemics like COVID and future public health emergencies. I could go on, but I'm aware of time.
Also, how early we can start with the awareness campaigns, because if you're talking about how a healthy lifestyle reduces drastically the chance of having dementia, then we need to start at a very early stage with the awareness of a healthier lifestyle. Ms. Barbarino, taking a more global view, how do the challenges within dementia care in Qatar compare to those globally? Are there any key differences or similarities? You need to unmute your laptop.
Thank you very much for allowing the global perspective on the panel. It has been a pleasure to collaborate on this report, and I really think that we need to focus on how Qatar has been embracing the challenge of dementia. They've been quite exemplary, because throughout the process they have been looking at the global best practice and try and take the best that the world can offer, and also try and apply it concretely and practically and culturally appropriately to the Qatar size and experience, to a point that now we can really use the Qatar example as an example of excellence for the rest of the world. And this has been really an impressive way to go about the challenge. And as Dr. Hamad, as before her, all the speakers have pointed out, dementia is a very complex issue, and there are so many angles to it that we could speak about it forever. but we do need to focus on each one at a time. So the issues of care, and I think, again, Dr. Ahmad has spoken a lot about awareness raising and stigma, is inextricably linked with that. A lot of governments around the world are still in denial about dementia. They're still refusing to admit that dementia is an issue. Now, Firas has given us a lot of numbers, many of which from WHO, many of which from my organization, from ADI, but let me give you a number that we haven't talked about yet. In 2015, we calculate that 82 billion hours globally were spent caring for someone with dementia, and that is the equivalent of 40 million full-time workers. And we estimate that by 2030, we're going to talk about 65 million. So this comes from a report that we did with Karolinska University a couple of years ago on informal care. So the issue of informal care is global. Everywhere in the world, people are providing informal care. And what for me is really important is that everywhere in the world, the underlying issue is about love, is about care. People are providing this care because often nothing else is available, and they love the people that they're caring for. And from that love comes a very great inner strength. And what we are trying to do here is to channel that inner strength, to channel that positive engagement and transform it into practical policies that can be applied at global level. So what I can tell you is that what I have seen in Korea, what I have seen in Kenya, what I have seen in Guatemala does not much differ. The cultural way that people go about caregiving may differ, but the underlying desire to help people that are in caregiving difficulty is there. And what has been always very heartwarming is the way that people like Suzanne Ahmad are so keen and open and generous in trying to share what they learn from their experience with the rest of the world. So we have seen it over and over again during this COVID pandemic, when we have lost, let's make no mistakes, a huge amount of people with dementia to COVID-19. In Italy, they estimated around 20%, in England 26%, in Canada up to 66% of people in care homes had COVID-19 and died of COVID-19, had dementia. So especially now, we have had challenges that we hadn't had before, and the whole world has gone together. Taiwan and France taught the rest of us how to advocate to our governments to stop governments from arresting or fining people with dementia wandering in the street without social isolation or mask because they didn't understand it, or to help caregivers globally understand how to approach a person with dementia that may be very confused about someone wearing a mask. So these examples have been wonderful. And the way that we have all shared them freely and openly and quickly in order to do something, because this is, as somebody else pointed out earlier, this is as an avalanche, it's a torrent. We are not going to stop it. This is growing over and over again every single day. This is a big issue, and we do need to do our uttermost best. And yes, we do need research. Yesterday saw another great initiative being launched around research, for example, and we do need perhaps therapies that will help us eventually overcome this disease. That we certainly need. But in the meantime, we need care, and we need love, and we need to share.
You answered one of the questions that were directed to you about how did COVID-19 affect dementia patients, but how can we support carers who are now working 24/7 with dementia patients post-COVID-19?
Yes, this is a great problem. There are two things that are emerging now from the COVID-19 pandemics. There are many, but these two are relevant to your questions. One is that people living alone or relatively well alone or with their family with mild cognitive issues they seem to be deteriorating as a consequence of social support services or the support of their families or of their wider circle narrowing because of the social distancing measures. So this is a big, big issue. The second one is about mental health issues of carers. We have had reports all over the world that carers that are in caring position in the absence of social support, in the absence of social services, are experiencing a much, much larger problem, and they are starting to feel that their caring responsibility, which is always very big, is becoming untenable. So we have a number of suggestions about this, and we've been publishing and creating resources online, as the people on the panel know, now for about 6 months. So there is too much really to go into this panel, but I would suggest anyone that has put that question to look at the website of Alzheimer's Disease International, alz.org.uk, and look at those resources, many of which are available in a number of languages, including Arabic, and they are culturally appropriate to the circumstance, because that's the other thing.
Especially for carers who are suffering from isolation, try to seek online help or online counseling that can help you maybe a little bit ease the isolation feeling. Dr. Al-Ajnaf, we have a question that you might be able to answer. Alzheimer's is the most common cause of dementia. In the past 20 years, there has been more than 100 attempts to develop an effective drug to treat Alzheimer's disease. Why have pharmaceutical companies failed until now to develop a cure for Alzheimer's?
This is a really important question. I think, as you outlined it, that the many clinical trials failed for the last 15 years or so. And I must say, a lot of funding and, has been wasted. But however, I think the most, point that I would like to highlight, what I've noticed, the drug company or pharmaceutical companies, they don't learn from mistakes or from the failed clinical trial, which has been already reported. They keep repeating the same approach, the same target, and the same way has been done before, and they expect it to get a different outcome. I always shout loudly and say, you will never get a different outcome if you're using the same approach. Simply, I think the most challenging part of it was starting the clinical trial quite late. I mean, by the time any patient show any signs of dementia or Alzheimer's disease specifically, most of the neurons at that affected region already lost. Mm-hmm. Not only that, the disease started about 15 to 20 years, started progressing before they shown the clinical signs. And therefore, it is too late to start any intervention, any cure or treatment for those patients. Having said that, Alzheimer's disease, like been one of our panel members highlighted, it's heterogeneous. By the time at the late stage, they shown really clear symptoms, could be another pathologies also developed. And it has been studied, confirmed that Alzheimer's disease patient can develop Parkinson's disease pathology, dementia with Lewy body pathology, other type of dementia pathologies. And therefore, targeting only one pathology is not going to be enough.
Does genetic sequencing can help in early detection or prevention of or delaying dementia?
The genetic test can be conducted, but only can serve 15% of the total patient. But 85% of those patients, they are sporadic and we don't know the cause. Also, I think, therefore, what we learn from this failure of the clinical trial, two things. I think there's no one size fits all. Mm-hmm. We need to look at carefully. The disease is heterogeneous. As I mentioned, some of the patients develop different pathology from others. So, but what we need a clear markers that to help us personalize the treatment. So markers, they have to identify the patient at a very early stage. So there's an urgent need for us to work hard and try to identify, simple markers. There are imaging markers now quite advanced. The good news this year, there's a new development, which is blood test has been shown. It's about 4 or 5 different studies that showing promising that can detect the Alzheimer's disease 20, 15 years before they show any symptoms. I'm very, very excited. All the scientific community excited, and in QBRI, we are planning to develop such assay in-house and try to test it in our Qatari population.
From the numbers you are mentioning, I go to Dr. Hamad because it seems like since 85% are not genetic, and so it's more of the health style. In this, there comes a stigma also, because definitely most people will say, oh, they had a bad lifestyle, maybe they were on drugs early, or maybe they were smoking. We don't even know what could be the unhealthy lifestyle that caused this. How did the MENA region fight stigma around dementia?
I think we're still fighting, actually. The stigma is still there. And I just want to comment on Dr. Agnaf's, the fact that the cure is not there is one of the reasons that families feel hopeless. They feel, well, if there's no hope, why should we bring them in for early detection? So I just wanted to flag that. But about the stigma, I think it would be dramatically decreased with more information, the more they understand. Because, I mean, they're not stigmatizing. The modifiable lifestyle behaviors are not stigmatizing. It's exercise more. And correct me if I'm missing anything, Paula, but, exercise more, eat healthy, all the things that you need to do. Education was one, pollution is a new one that came up, alcohol is another. So they are all good things to do. So I don't see that as a stigma. I think the main stigma is that people are more comfortable talking about their loved elderly one with a physical illness. But when you talk about mental or cognitive, it's hard. It's hard to say my mother or my father or my whoever is, has a mental illness. So that is the main cause. We need to desensitize it and say dementia is a cognitive disease. It is not something negative. It's just like any other organ in the body becoming diseased. I think this is the main onus, that the information will correct a lot of the stigma.
I meant the stigma. If they got the disease, then people will say, oh, they had unhealthy lifestyle that caused the dementia. Firas, we have 1 minute for you to answer this question. Is there any policy in Qatar to support families with financial aid or leave from service to care for loved ones suffering from dementia, such as just in comparison to maternity leave when we have a child, then maybe when we are caring for an elderly with dementia, we could have a certain kind of care leave? Firas, you need to unmute your laptop.
Hi, yeah. Can you hear me?
Yes, now we can hear you.
To my knowledge, I'm not sure. Yeah, to my knowledge, that specific policy that separates dementia compassionate leave to other sorts of leave does not quite exist, but I am a bit hazy on the details. I would say in terms of future policies, I can't quite comment on that. And I would also like to defer to the panel in case there might be a gap in my knowledge.
So maybe we'll take this chance, and this panel, Dr. Hamad seems to have the answer to that question.
Yeah. Yes, I know from families that we spoke to that were employed. In employment, there is compassionate, like leave without pay. I think it applies just to Qatari nationals, but they were allowed to take a year or 2 of unpaid leave. Yeah, so there is that flexibility. There's also support where there's a benefit where they can get a paid, subsidized nurse and a domestic helper because of that, to care for the older person. So that's brilliant.
So from here, it's a shout out for governments to think about how they can support carers to provide the proper care to dementia. I'm very sorry, Ms. Barberino, but we ran out of time. Thank you, everyone, Dr. Al-Ajnaf, Dr. Hamad, Ms. Barberino, and Firas Almir from Wish Policy. Tune in tomorrow for the last panel, and I'm really sorry for not having the time for you. Stay safe and stay healthy. See you soon.